Assalamu alaikum. Today's article is a case report published in Research Society and Development in 2023 titled Management of External Cervical Resorption with Internal Approach with 18 months of follow-up. The case report described the non-surgical management of external cervical resorption using an internal approach. So a 22-year-old male patient presented with dentine hypersensitivity and pain in the left maxillary lateral incisor that worsened with hot and cold stimuli together with thrombin pain. The patient had a history of dental trauma at age of 12 followed by orthodontic treatment 6 months later. Clinical examination revealed small localized gingival swelling as a 6 mm mesiobuccal periodontal pocket and an exaggerated prolonged response to pulp testing. Radiographic examination showed an irregular mottled radiolucency mesial to the pulp space with preservation of the pulpal outline and crestal bone loss. CBCT demonstrated a cervical resorption lesion with a 180 circumferential spread and root perforation. The tooth was diagnosed with symptomatic irreversible pulpitis associated with a Patel classification 2CP external cervical resorption lesion. The tooth was treated non-surgically through an internal approach. Root canal treatment was performed using hand instrumentation and 2.5 sodium hypochlorite irrigation. Calcium hydroxide was placed as an internal medicament within both the root canal and the resorption defect, and at the second visit the apical and middle thirds of the canal were obturated with gutta-percha and H+ sealer, while the cervical third and the resorption defect were sealed with white MTA before definitive restoration. At 15 and 18 months follow-up, the patient remained asymptomatic, and the radiographic and CBCT examination demonstrated progressive bone regeneration, restoration of the crestal alveolar bone, and good adaptation of the MTA repair. The only adverse outcome was the tooth discoloration. So they concluded that external cervical resorption can be successfully managed with a non-surgical internal approach when pulp involvement is present. They emphasized that CBCT is essential for diagnosis and treatment planning. Calcium hydroxide helps arrest the resorptive process and promote repair, and MTA provides an effective seal of the defect, although it may result in tooth discoloration. Thank you.